Cancer. The word itself is quite frightening and it turns the life upside down. But do you know there are certain signs and symptoms of early cancer? If we know them, we can catch it early and prevent it, because early diagnosis saves lives and cause higher cure rates. In this video, we are going to talk and discuss 10 early signs and symptoms of probable cancer. Namaskar. Hi, I'm Dr. Avinash Talele, consultant medical oncologist and hemato-oncologist from Vishwara Onco Care Center. I am privileged to get trained from elite institutions like Tata Memorial Center, Gujarat Cancer Research Institute, and I've been helping and supporting cancer patients to beat and defeat cancer in compassionate way. Coming to the first symptom, unexplained unintentional weight loss. Well, weight loss is good, but if it is unintentional without doing anything, then it is an alarming sign. If you're not doing any healthy exercises, changing your dietary habits or lifestyle, and you are losing more than 10% of your body weight, that is a big red flag. It can happen in certain metabolic conditions, commonly diabetes, and also in visceral cancers like stomach, colon and lung cancer. So unintended weight loss should not be ignored. Address it out, find out why you are having it. Persistent fatigue. Everybody feels tired now and then, but if one is started to feeling tired more and more without doing much of exertion, to an extent that it is compromising in its day-to-day livelihood and work, so that person is not able to take care of his routine daily chores, it is bothersome. Cancer-related fatigue oftenly is seen in visceral cancers and certain blood-related malignancies like leukemias. The characteristic feature of this is, with rest, the fatigue gets okay. If the fatigue does not recover with getting rest, it needs to be addressed. Changes in skin. Appearance of new moles on the skin, plaques or patches, or change in the behavior or size of the pre-existing moles can be a sign of skin cancer or an underlying visceral cancer. Any change in the skin moles or plaques should be addressed by a qualified dermatologist, and sometimes we need to get it biopsied to figure it out. Persistent cough and hoarseness. Persistent cough for more than 3 weeks, often accompanied with blood in the sputum. Occasionally people have weight loss with it. If this is there, it has to be addressed. You cannot just step it over. It can happen commonly in chronic respiratory conditions and infective causes like tuberculosis, chronic granulomatous conditions, and lung cancers. It is particularly more common in people who have smoking habits or people who consume tobacco. Unusual bleeding. Unusual bleeding, like bleeding from stools, that is from the GI tract, postmenopausal bleeding or postcoital bleeding. This is an alarming sign. Postcoital bleeding is often a common presenting symptom of cervical cancer. Blood in the stool can be due to various benign causes and also due to the growth in the colonic region of the body, commonly seen in colonic cancers. Appearance of lump or a thickening. Appearance of lump which can be painless, usually in the breast, neck, axilla, can be a certain sign of early cancer. Any lump in the breast, an undue prominence of blood vessels, asymmetry in the breast should be addressed. Women beyond 40 years of age should do monthly self-breast examination and an annual mammogram to address the breast swellings. Other swellings are common in testicle, axilla or groins. Any swelling in the groin, it can be commonly due to lymph nodes. If it is persisting for more than 2 to 3 weeks, it has to be addressed with imaging and biopsy. Difficulty in swallowing. If you feel like food is getting stuck and you have difficulty in swallowing or painful swallowing, it can be because of certain normal conditions like acid reflux, and also it signifies esophageal cancer or laryngeal cancers. Changes in bowel and bladder habits. Alteration of bowel and bladder habits in the form of constipation alternative with diarrhea, diarrhea with weight loss, commonly is seen in stomach and colonic cancers. Frequent micturition, passing of blood in the urine, frank blood, is a sign of bladder cancer or a kidney cancer. Any gross visible blood in the urine should be an alarming symptom and should be tested ASAP to figure out the cause. Chronic persistent pain that does not go away or is partially suppressed by an analgesic medicines just to come back again on its own is usually a telltale sign of underlying cancer which is encroaching upon pain sensitive structures. You should address these things and get them evaluated by a qualified doctor. These symptoms does not mean you have cancer, but ignoring them can be harmful. Don't look them over. Meet your doctor and get them addressed because early detection saves lives. If this information is helpful, share it with people near and dear to you and keep people informed, keep people safe. Don't forget to subscribe for more such authentic health related information by qualified experts.